Back pain rarely has one single cause. It's often due to wear and tear change in the discs, which are shock absorbers in our spines, and also wear and tear change in the small joints or facet joints in the spine. 85% of the world's adult population at some point in their life will suffer with back pain.
Treatment post-surgery is often different to treatment without surgery, and a lot of that is because you have to be careful a little bit after you've had surgery in terms of what the therapist can and can't do. And the key principles for post-surgical patients is to just encourage them to start moving again, generally increase their activities, control their pain with pain relief, and make sure that the wound where they've had the operation site is all healed over and that's going okay. A lot of it is one-to-one physiotherapy, whereby the therapist will educate you and advise you and talk around why you have your pain and get you to understand it a little bit better. Again, it might include some manual therapy techniques and some massage or some joint mobilizations or maybe even some acupuncture. But we'll also get you back into exercising, and part of the problem with people who've had persistent pain for a long period of time, they might be fearful of exercising or not doing the things and the activities that they enjoy. And these sessions, these intensive therapy sessions, will get you back doing some exercise in a graduated and paced way. The equipment that we can use is the anti-gravity treadmill. It's a great way of getting people back into doing exercise but trying to reduce some of the load that they're putting through the spine. But also we can use the Nordic Health spinal stability equipment that will help you to start moving again in a very controlled way, and also starting to exercise and strengthen some of the muscles that help to support and stabilise your spine. Another piece of equipment that Circle Rehabilitation has is an aqua treadmill. So it's similar to a hydrotherapy pool, but we're using it on a one-to-one basis. So it's a treadmill that fills up with water. To help progress the patient's treatment is also very rewarding when you see that the patients are achieving their goals to get back playing their sport. Probably the most common goals that you have with patients when you sit down is to get them back to doing their normal functional life, to being able to sign a patient off at the end and then say, hey look, I can now go out and play and kick a ball around with my kids in the garden is hugely satisfying. It's always very, very important for the patient to have an understanding of what type of activities they need to then do to help them with their symptoms. Because empowering the patient and having the patient being able to understand it and being able to do some things themselves is very important for preventing it reoccurring in the future.